Hello, I'm Dr. Lambilan from Ageless Medical. I've been a medical doctor for more than 2 decades, in aesthetic medicine for 18 years. Today, I'm going to share with you core-to-floor therapy using Emsculpt Neo and Emsella. The core muscles are the epicenter of the body, and it encompasses more than the abdominal area. It consists of the diaphragm on top, the pelvic floor muscles below, the abdominal muscles in front, and the back muscles. The weakest link is the pelvic floor, as it is located right at the bottom of the core, and it has to withstand the most pressure. Now, the core muscles surround our waist like a belt, and its main function is to stabilize intra-abdominal pressure, the spine, and our pelvic floor. Having a strong core ensures better sitting and standing posture, and at the same time, it portrays an elegant and sophisticated vibe, giving an overall positive first impression. Now, we have 2 types of fats. The pinchable subcutaneous fats that is found beneath the skin, and they can be found on your waist, your love handles, your saddlebags, and even your bye-bye arms. The second type of fats are the visceral fats, and these are found deep within the abdominal cavity surrounding our internal organs, for example, the stomach, the intestines, our liver, and the pancreas. Now, many clinical studies have been done to show that excessive amounts of visceral fats will increase your risk of getting cardiovascular disease, diabetes, high blood pressure, and even polycystic ovarian syndrome in women. Now, as we know, to lose fats, 80% comes from dieting and 20% from exercise. To tone the core for abs, we need to exercise regularly. However, it is very difficult to spot reduce a particular area of stubborn fats through just diet and exercise. For example, if you want to just reduce fats around your love handles, your abdomen, your saddlebags, or your arms, it is difficult to just do it through diet and exercise. Now, to accelerate losing fats and building muscles for a toned physique, some may opt for non-invasive treatments, for example with Emsculpt Neo, that target both reducing fats and building muscles at the same time. We are aware that there are many devices available in the market that use different technologies to reduce fat. However, to reduce fat and build muscles at the same time, Emsculpt Neo is the world's first and only US FDA cleared device using 2 technology, radiofrequency to burn fat and to tighten skin, and the HIFEM technology, which stands for high intensity focused electromagnetic energy to build muscles. Now, this is a non-invasive and no downtime treatment. Now, as we know, fat loss is based on burning more calories than what is taken in. However, this causes a loss in muscle mass as well. Studies have shown that to lose fat and to gain muscle at the same time, a high-intensity exercise regime and a high-protein diet is needed. Now, treatments such as the Emsculpt Neo can burn fat while building muscles at the same time. The HIFEM technology, which stands for high intensity focused electromagnetic energy, first depolarizes motor neurons that leads to muscle contractions. The device can induce 24,000 supramaximal contractions of the muscles in the targeted treatment area. Now, supramaximal contractions occur when the HIFEM energy contracts 90 to 100% of the muscle fibers within the magnetic field, and these contractions achieved through HIFEM stimulation cannot be achieved during a normal voluntary workout. Now, supramaximal contractions in layman term also mean that the muscles are contracting at a supercharged rate, which the body cannot produce via exercise. Now, the RF technology also adds a synergistic effect to the HIFEM technology, in that 1 + 1 is not equal to 2, it is equal to 3 or 4, and the RF is able to cause apoptosis or fat cell death. Now, within 4 sessions, 30 minutes each session, clinical studies have shown that Emsculpt Neo is able to increase up to 25% of more muscle mass and reduction of up to 30% of fat. optimal results show 4 weeks after and will gradually improve over a period of 6 months after the last treatment. Yes, Emsculpt Neo has radiofrequency technology that heats up the muscles, raising the temperature to 40 to 43 degrees Celsius, causing apoptosis or fat cell death. The fat cells that are killed are then eliminated from the body via the lymphatic system. Now, clinical studies have shown that the HIFEM technology is able to reduce an average of 30% of subcutaneous fats up to 14% of visceral fats. With the combination of RF, results have shown that muscle thickening also increased up to 25%. Now, depending on the individual, most people will not feel fatigue or muscle soreness after the treatment. Now, Emsculpt Neo has 7 different alternate contractions of long and short frequencies. It also has a tapping mode, which help to release lactic acid build-up in the muscles caused by the contractions. This reduces the soreness after the treatments, so unlike exercising, Emsculpt Neo does not lead to fatigue. Now, the number of treatments required is dependent on your desired results and where you are starting in terms of muscle tone and undesirable level of fats. Now, results are usually felt after the first treatment, and most patients feel the effect of toned muscles. Now, more than 1 session is usually needed to achieve your desired results, and we recommend 4 sessions of 30 minutes of Emsculpt Neo at weekly interval. Optimal results are seen 4 weeks after and will gradually improve over a period of 6 months after the last session, and it will continue to improve weeks after. Now, Emsculpt is launched in 2018 in Singapore, and Emsculpt Neo is launched in 2020, and Emsculpt Neo is the improved and upgraded version of Emsculpt. Emsculpt Neo is able to generate more than 24,000 supramaximal contractions, while Emsculpt can generate only 20,000. The Emsculpt works with the HIFEM technology, while Emsculpt Neo has both HIFEM technology and the radiofrequency technology, and the radiofrequency technology can help to burn fats and to tighten skin. With a combination of HIFEM and radiofrequency technologies, clinical studies have shown that the Emsculpt Neo can achieve up to an average of 25% more muscle mass, reduce up to 30% of subcutaneous fat, and up to 14% of visceral fats, while Emsculpt can only achieve up to 16% of muscle mass and reduce up to 19% of fat. Additionally, Emsculpt Neo can reduce up to 19% of diastasis recti, while Emsculpt can only reduce up to 11%. Now, diastasis recti is a partial or complete separation of the rectus abdominis, or the six-pack muscles, which meet at the midline of your abdomen. Diastasis recti is very common during and following pregnancy. This is because the uterus stretches the muscles in the abdomen to accommodate the growing baby. One study found that an average of up to 60% of women may experience some form of diastasis recti during pregnancy or postpartum. This condition, of course, is not limited to pregnancy. It can affect anyone, including newborn babies and men. In some cases, it can result from lifting heavy weights incorrectly or performing excessive or unsafe abdominal exercises. A study done on the safety and efficacy of the HIFEM technology found that HIFEM can reduce diastasis recti by 19.2% in most of the subjects after the treatment. Now, Emsculpt Neo can be used on multiple parts of the body, such as the abdomen, the buttocks, the arms, the thighs, and the calves. However, as mentioned earlier, our core also includes the back muscles and the pelvic floor muscles. For the pelvic floor muscles, with Emsella, a device that helps to strengthen the pelvic floor muscles and to reduce urinary incontinence. Now, Emsella is a US FDA cleared device for strengthening the pelvic floor muscles, and for the treatments of urinary incontinence in both males and females. Now, Emsella utilizes the HIFEM technology, which stands for High Intensity Focused Electromagnetic Energy, and targets the pelvic floor muscles without conscious efforts on your own. It delivers more than 11,000 supramaximal contractions of the pelvic floor muscles or Kegel muscle contractions in a single 28-minute session. Now, this is essential in muscle re-education of incontinent patients, women after childbirth, and those with decreased intimate satisfaction. Now, combining Emsculpt Neo and Emsella, it provides a holistic core-to-floor muscle workout, utilizing both the RF and HIFEM technologies to strengthen, firm, and tone the abdominal muscles and the pelvic floor muscles. It also reduces abdominal separation, known as diastasis recti. This helps to kickstart the building of strong core muscles, resulting in an elegant and sophisticated posture for an overall positive first impression. It also helps us to have better stamina whenever we exercise. Obviously, to maintain optimal results, maintaining a healthy lifestyle with regular exercise is also important after treatment with Emsculpt Neo and Emsella.